Let's go over the most missed question on any medical coding certification exam. Here's the facts. A surgeon is going to evaluate a new patient complaining of pain and numbness in the wrist and agrees with the PCP that it is carpal tunnel syndrome. The surgeon documents the chronic illness that the patient has because they have the PCP notes, and they schedule a neuroplasty for the patient's nerves in their wrist for the next day. How should this evaluation be coded? So we have new patients to the surgeon. The surgeon agrees with PCP. The PCP sent records to the surgeon, and the surgeon schedules surgery next day. So how should this evaluation and management service be billed? We have office consult, we have established patient, we have new patient, or we have another way maybe we could code this. What do you guys think? If you like this content, be sure and like, comment, share, and don't forget to follow the YouTube channel and join our free Discord study group. It's super helpful. YouTube, we do 6 hours a week, 3 days a week. We do 2 hours of free Q&A where I try to help you with your medical coding career and help along with questions just like this one. I go live every Monday, Wednesday, Friday at 6:30 Arizona time zone on YouTube, so join in. But for this question, there is no bill, no code for any evaluation and management because this is a pre-op visit. We have guidelines here on page. If you're in the 2023 CPT book, we have surgical guidelines, and right here what's included in a global surgical package is your evaluation and management visit for the day prior or the day of a surgery. So it's going to be included in that surgery code for that carpal tunnel neuroplasty that we're doing tomorrow. So the code for the neuroplasty will take care of this E&M visit. I hope you found this helpful, and I hope to see you during my lives every Monday, Wednesday, and Friday. Remember, it's all free, guys. I hope to see you there. Southern Fried is asking when we can utilize our E&M with our 57 modifier over the pre-op visit, according to our surgery guidelines here in our book about the E&M visit is included in our CPT code for the surgery if it is done within the same day or previous day prior to the surgery. So if you be sure and check out the last video before this one because it talks over this whole scenario and what's going on. And don't forget to attend my free live lessons on medical coding every Monday, Wednesday, Friday on Friday. And if you like this content, be sure and like, share, and save, and comment on these, what else you would like to see. But so how we would utilize this and use our E&M code with our 57 modifier, we would have the same scenario. PCP sends the patient for a consult to the surgeon, sends over the records for the doctor to review of that wrist. There is a decision for surgery. There's enough data that is reviewed with all the old films, with the extra historian, and they confirm that the patient does sincerely need to have surgery. The appointment for this consult happened on a Monday, and then the surgery would end up needed to be some space away, like on a Friday. A lot of our physicians do that. They see patients during the week, and then Fridays are their surgery days. This would constitute being able to bill a 99243, probably on our data points that we have with reviewing old films and that decision for surgery and it being a new patient. And then we would get to bill our 57 modifier for that decision for surgery. There's also one other caveat to this that we can utilize. I'll explain it in another video where we can do this in another location and still be able to use an E&M visit. But this particular situation, we would need just time to be different. Like in our previous scenario, on my previous exercise, this one, the surgery was scheduled for the next day. And that particular one option makes it to where you don't bill any E&M and you have no modifier. I hope this is helpful, and I hope to see you during my lives on Monday, Wednesdays, and Fridays on YouTube. I hope this is helpful. Hey Southern Fry, here is your 2-for-1 question. So another scenario where we could use an E&M with a 57 modifier over a pre-op guideline that says you can't use an E&M code in the modifier. Let's say a patient is in a car wreck and they come into the ER. ER doctor takes one look at them and says, yeah, you need surgery. And your face is tore up and you're going to need a plastic surgeon, right? So ER doc calls in plastic surgeon to come into the office, to the ER, to see this patient. Plastics gets there and says, yep, this one is a winner, needs to go to surgery to fix a facial laceration. Both doctors do a full history, and both doctors do a full exam. Both doctors document their exam and history in the ER chart. We are going to bill, which is probably going to surprise a lot of you guys, also our 99243 with the 57 modifier for this one, even if the surgery is scheduled for next morning. This is got to do with different sites, locations, because an ER is a clinic where hospital is for surgery. The documentation for this visit is in the clinic. It wasn't documented in the hospital as part of a hospital admission. So we get to bill this for this scenario, even though it's less than the 24-hour situation because we're not already admitted and near the hospital. Well, I guess I shouldn't say we're near, but admitted into the hospital. I don't know. I hope this is helpful. It gets crazy, doesn't it? Gotta love medical coding. Practice makes perfect, and I hope to make this easier for you. Location and patient status matters.